And welcome back. So it's our medical slot now, and people have really taken to this, and I must say we enjoy it a lot as well and are learning so much along with you. So this morning we are honing in on interventional radiology. Now this is an amazing medical procedure that utilizes advanced image-guided techniques to diagnose and treat a wide variety of conditions. Now, these innovative procedures often offer a less invasive alternative to traditional surgery. And today we're focusing on how the frequently underestimated field of interventional radiology is viewed, and of course its positive impact, especially on women's health, as it is still Women's Month. And joining us this morning is Dr. Dale Creamer, who is Head of Interventional Radiology at Groote Schuur Hospital, and he joins us. He's also Director of Cape Town's Interventional Radiology at his private practice based at Netcare UCT Private Academic Hospital. Dr. Creamer, thanks so much for your time. Welcome to Morning Live. Okay, let's get straight into it. So please, if you could, Dr. Creamer, let's just elaborate and explain in layman's terms this concept of interventional radiology and, of course, its benefits.
Yeah, so radiology is basically there's different types of imaging that radiologists use to make a diagnosis. And that could be X-rays, CT, ultrasound, MRI, etc. And where it changes with interventional radiology is instead of just diagnosing, we actually use the same imaging modalities to actually work within the body to fix specific problems. So,
as far as women go, Dr. Creamer, in terms of some of the less invasive surgical possibilities here, what are some of the more prevalent women's health concerns that can be addressed through interventional radiology?
So I'd like to break it up into four particular procedures that are offered by interventional radiology that will be really helpful for women. I call them the three life-changing procedures and one life-saving procedure. The three life-changing procedures are, firstly, the impact of uterine embolization. So fibroids are these benign or non-cancerous, and they actually cause a lot of problems. And irregular urination. So we are able to actually work within the body and actually fix these problems by blocking the blood vessels to these fibroids in the uterus, which makes them shrink and definitely improves quality of life. The next problem that we deal with that is life-changing is something called fallopian tube recanalization. So one of the problems that's facing the world at the moment is infertility. And sometimes this can be due to tubal blockage. So that's the fallopian tubes itself, which can happen after an infection or etc. And we actually have a technique where we use the catheters, wires, and this contrast dye that we use to see inside the body to open up these tubes. And there's actually a 41% chance that you fall pregnant after the procedure, so within the next 12 months. And then the last life-changing procedure that I wanted to talk about was something called pelvic congestion syndrome. So pelvic congestion syndrome is basically, if you imagine varicose veins in your pelvis, so the dysfunctional veins that are causing a lot of pain and discomfort, and you can imagine that women really don't have a great quality of life with these particular problems. And we actually work within the body and redirect the venous flow and therefore stop this pain and improve the patient's life. So we move on to life-saving procedures. And one of the most devastating problems we have in South Africa is something called postpartum hemorrhage. So So postpartum hemorrhage is basically when a mom delivers a baby and her uterus fails to contract appropriately. So what happens is she has a prolonged time of bleeding. And, there's lots of different treatments that are applied to try and stop the bleeding. But often the only alternative that is offered is actually removing the entire uterus. So in hospitals that don't have an interventional radiologist available, this is the only alternative that they have to save the mom's life. So we will actually go in an emergency and go and temporarily block the blood vessels to the uterus and allow it to contract. And this saves women's lives, and this also enables them to have children at a later stage of their lives. So those are the 4 things that I'd like to talk about.
And just to the last point there, do we have a sufficient number of these practitioners available who can perform the interventional radiology procedures? Because, as you say, in instances where you don't have one available, they have to remove the entire womb, for example. So, whereas they could have had an intervention that would have been less invasive, so to speak. So, do we have enough practitioners, or how sparse are you populated across the country at the moment?
Sure. So that's a good question, Sakina. Unfortunately, South Africa, personally, we don't have our own training program for interventional radiologists. I had to go and train in Canada. As a result, there aren't that many of us around. But I think that there needs to be an increasing, importance placed on having interventional radiologists available at hospitals, high volume maternal centers, to make sure that these problems can be taken care of. But unfortunately, there aren't a lot of us around to do these things. Yeah.
Which is, of course, perhaps somewhat problematic in one way, but perhaps good for those of you who are available, because women who would know about these alternatives, I would imagine, would take them up. Do you think there is sufficient knowledge about what you do at this stage, and also the availability of these non-invasive procedures?
I think that if I had to be honest, I don't think that most doctors even know what interventional radiologists can do. Interventional radiology is a very, very new subspecialty. And due to the lack of access in South Africa, it's been quite difficult to get the word across, and that's why I'm so grateful to be offered the opportunity to speak about it here today. So it's important that, within, wherever we are trained in Canada, for example, interventional radiology was quite prominent, and all the hospitals and doctors knew about it. But I think in South Africa, we have to have our own patients learn about these procedures, which the information is freely available online, hopefully through reputable sources, please. We can just. I am doing a lot of academic work and presentations for the departments around me, and trying to teach other doctors about what I can do and what services I can provide to enhance patient care.
Yeah. Unfortunately, we have to leave it there, but hopefully we'll create another opportunity to speak further. We lost some time there with the technical difficulties. But thanks so much for your time, Dr. Creamer, for generously sharing your valuable insights and providing important information on interventional radiology.